today. But I wanted to welcome you. My name is Scott Fishman. I'm a pain specialist here and a professor at the School of Medicine, but I'm also the executive director of the Office for Wellness Education. And our goal is to help transition our school from really a sole disease response perspective to a health system that not only goes beyond disease response to prevention, but teaches students to be more than disease responders. So this is really part of that effort. It's not the part where we're going to teach you how to try to use aromatherapy for yourselves or get exercise for yourselves. It's really about your scope of practice and hopefully widening what you see as your scope of practice, because it's a huge need. It's what your patients need, and ultimately they will expect from us. So without further ado, I want to introduce Professor Dossett, who trained actually medical school at UW, but did most of her postgraduate training in Boston, in the Harvard system at Beth Israel Hospital, which is a place that is quite famous for mind-body medicine. A lot of what we know now started with a fellow named Herb Benson, who wrote a book that I read when I was in college called The Relaxation Response. It's a very, very readable small book, and probably was the beginning of my thinking about these issues that we're dealing with today. And Dr. Dossett was telling me she had the privilege of working with Dr. Benson, who's really one of the founding fathers of really the mind-body movement. We were very fortunate to recruit her. She's an internist with extensive experience in this area in integrative medicine, and she's the director of integrative medicine here at UC Davis. She's also a very avid scientist and researcher. I'm not going to spend much more time going through her bio, but it's quite long. It's very impressive, and it's really a blessing to have someone like her and her team here doing this work that I think some of you may not know about, but I think many of us are just learning about. So without further ado, Dr. Dossett, and then we'll probably have a break in maybe 10 minutes or so.
Absolutely. Thank you, Dr. Fishman. Appreciate the kind intro. Appreciate all of you for coming today. And I'm going to share with you my perspectives on integrative medicine and what it is, and what you guys should all know about it. And hopefully we'll have some time for discussion. Please raise your hand with questions. My only disclosures is that I am a contributing author to Up to Date, but I'm not talking about anything related to the topic that I've received royalties on, and I do receive funding from NIH. So our goals today are to understand what integrative medicine is, the role that integrative medicine can play in improving public health and reducing disease burden, hopefully to give you guys an approach for how to talk with patients about this, and identifying some quality sources of information so that you can look this stuff up when you have questions about it. So I want to start with this question of what is healing and how can we promote it? And this is a little bit about my own journey with this topic. I grew up in a family that used a variety of both conventional medical approaches as well as what was known back in the 1980s as alternative or holistic medicine. And really, sort of lived in these two worlds for quite some time and felt like there was a lot of benefit from what I was seeing from some of these less conventional approaches, and wondering, what's the evidence behind this and how can we integrate this more into medical care? And so I want to start with some perspectives of where are we in our healthcare system and healthcare in the United States right now? 6 out of 10 adults in the United States have at least one chronic disease, and 40% have 2 or more chronic diseases. And these are some of the leading causes of death and disability in our country right now. We also have a huge issue with mental health in this country. Almost a quarter of the US population had some kind of mental health issue in 2021. And this is not just because of the pandemic, my friends. These numbers are not that much higher than they were pre-pandemic. Prescription medication use. 70% of US adults age 40 or older use at least one prescription medication on a regular basis. Almost a quarter of adults age 40 or over are on 5 or more prescription medications on a regular basis. And this is a recent study on the prevalence of adverse drug reactions in the primary care setting. And it's pretty high, actually. They found across 33 studies that the incidence, so the prevalence of adverse drug reactions was about 8%. If you look only at the highest quality studies with low risk of bias, that incidence is 20%. And they concluded that 23% of these adverse drug reactions were preventable. 50% of these interfered with work, leisure time, daily activities in some way. And somewhere between 1% and 9% of these resulted in a trip to the emergency department or hospital admission. So, my question for all of you is all of this stuff that we're seeing here necessary? Or is there something we can do about it? And the answer is there is. 80% of chronic disease is preventable. And it's preventable with these simple lifestyle wellness approaches. Not smoking, eating a healthy diet, being physically active and maintaining a healthy weight, avoiding excessive alcohol and other substances, and dealing with stress in a healthy way. It seems kind of simple, but we all know that this isn't living in modern America, right? There's a lot of things that get in the way of all of this. And yet these are the kinds of primary prevention things that as physicians we should be working with our patients on, rather than waiting till they end up with one or more medications, many of which can cause adverse effects, right? And I'm not saying that medications are bad and that we don't have a place for them. We do. There's a lot that we can do. But there's a lot that we should be doing before our patients end up there. And this is something that integrative medicine can help out a lot with. This is just one of many studies. This comes out of Europe, over 100,000 people. They looked at a variety of different healthy lifestyle factors and gave people points for the number of different healthy lifestyle factors that they were following. Those with the greatest number of points had almost 10 additional years free of type 2 diabetes, heart disease, stroke, cancer, asthma, chronic obstructive lung disease, compared to those with the fewest number of points. So we do see that this stuff works. So what is integrative medicine? This is the definition from the Academic Consortium for Integrative Medicine and Health, the society that I consider my academic home. They say that integrative medicine and health reaffirms the importance of the relationship between the practitioner and the patient, focuses on the whole person, is informed by evidence, makes use of all appropriate therapeutic and lifestyle approaches, healthcare professionals, and disciplines to achieve optimal health and healing. There's a lot packed into that. And I'd like to sort of take that apart a little bit more for all of you. So in integrative medicine, we really emphasize relationship-centered care. I'm fortunate I have an hour for an initial consult with a patient to really get to know them, understand what are their health concerns, what makes them tick, what is it that they want out of their life, what are the challenges that they're facing. And we integrate conventional and complementary methods for treatment and prevention. So sometimes I do prescribe medications, or I recommend other more sort of conventional approaches, but I'm also bringing in other tools, and I'm meeting the patient with where they're at, and I'm saying, you know what, we could try this, 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 or this, and this is the data. What would you like to do? And engaging them in that informed decision-making process. We try to remove barriers to activation of the body's innate healing response. So, you know, if we can I saw somebody in my office last week, has had multiple cardiac procedures, and he's fairly young, and probably has some kind of, and very physically active, and he probably has some kind of genetic contribution to causing his cholesterol to go up and to have these multiple heart attacks. And so what did we do? We started talking about his diet, because that was the easiest place to begin. And we have very good data about dietary changes that can reverse cardiovascular disease. Nobody had talked to him about that before. And he's had multiple stents and a bypass. We try to use more natural, less invasive, less costly interventions before those that are more costly and invasive. And we try to engage all these different components of the human being, mind, body, spirit, and community, to help facilitate people's healing. And that healing is always possible, even when sometimes curing something is not. And we use an evidence-informed approach because, there aren't big companies doing multi-million-dollar studies of herbs that we can't patent or some of these other approaches. And so we go with the best available evidence out there, and I'll talk a little bit more about that as we go along. This is, by the way, is an excellent textbook on integrative medicine, and it's just been updated and newly released, and you all have access to this through the library here. So the terminology for this has changed over the years, and so as I said, when I was growing up, it was referred to as holistic or unconventional or alternative medicine. And then we called it complementary and alternative medicine, recognizing that these tools could complement what was currently offered in conventional medicine. And for the last decade plus, we've been using this term integrative medicine to refer really to the integration of a variety of different therapies to help promote health and well-being. Is this a good time to take a break? All right, let's do that.
Okay. So,
thank you. So when people ask me, what is integrative medicine? Like, what are we talking about in terms of modalities? I think of it in sort of 5 broad categories. And the ones that I have in bold here are the ones that we offer in our clinic here at UC Davis. The first, biologically based therapies. Therapies that sort of work with, on the molecular level, we think, in terms of our biology. Things like special diets, supplements, and then there's this whole field of functional medicine that I'm not going to go into detail right now, but if people have questions, we could talk about it later. Then there's things that work more with sort of our physical being, manipulative and body-based methods, things like massage, chiropractic, and osteopathic manipulative medicine. There are things that work with the mind-body medicine, things like meditation and yoga and biofeedback and Tai Chi. There are whole alternative medical systems from other cultures. Traditional Chinese medicine is probably one of the more well-known ones, of which acupuncture is just a part. There's Ayurveda, which is the traditional medical system of India, and homeopathy, which comes out of Europe, and many other traditional medical systems from many indigenous cultures. And many of these systems have their own sort of philosophy of what disease and health are about, and a multi-pronged approach for helping people to stay well and to treat disease. That includes many of the things in these other buckets. And then there are therapies that we think of as energy medicine, things like Reiki and therapeutic touch, and others. So these are the therapies that we think about. But as I showed you earlier, integrative medicine is much more than just about the therapies that we offer. That's just a part of it. So why, as a physician, should you care about integrative medicine or any of these things? And I think there's 3 primary reasons. One, is there's a potential here for a lot of benefit for our patients. Two, there's also the potential for harm. I mentioned some of my early experience growing up. I got a lot of benefit from many of the therapies that my parents tried, but we also had some side effects from a couple of these therapies as well. And so thinking about safety is also important here. And then the final thing is I think this is really an opportunity to partner with our patients because our patients are using these therapies. This is data from 10 years ago, and I can tell you these numbers have only increased since then, on the use of natural products, deep breathing, yoga, and other practices by the US population. This is from a national survey that the CDC conducts. This is use in pediatric populations. Parents are giving this to their kids. Oftentimes they perceive that these therapies are safer. And so they'll reach for that first before something else. So I could spend over an hour talking about the data on integrative medicine for various health conditions. And we don't have the time, and that would just bore you all. So I'm going to just give you a very broad overview with a few citations of some of the health conditions that integrative medicine can address. Obviously, cardiovascular diseases and risk factors, there's a lot that we can do here from diet and supplements and mind-body medicine approaches. Gastrointestinal conditions, both functional as well as inflammatory conditions can benefit a lot. Again, a lot we can do with diet, with supplements, with mind-body approaches. Mental health, again, same categories, but also adding in physical activity and a few other things here. And autoimmune conditions, because autoimmune conditions are ultimately diseases of inflammation, like cardiovascular disease and many other things, the chronic illnesses that we deal with. And so they're very amenable to a number of these integrative approaches. Okay, this stopped working. All right, and chronic pain. We have, an epidemic of chronic pain in this country, and there's a lot that we can do with integrative medicine to address chronic pain. This is from a white paper that was published a few years ago, talking about how these approaches can be used as standalone interventions or in combination with medications, procedures, or surgery, that oftentimes they can help reduce patients' need to use opiate medications or other medications. And oftentimes they're addressing not only pain, but other things that go along with pain, like anxiety and depression, or nausea and vomiting, or sleep problems, and help facilitate an improved sense of well-being and patients' recoveries. And they can improve function with benefits that can last well beyond the actual duration of the intervention that we might provide. And there's data that this reduces healthcare costs as well. And these are just some of the tools that we can use from the integrative medicine toolbox that have a role to play in helping with pain management. So I'm going to share with you a few cases from my clinic. They'll happen to be women. I apologize for that. I do see men as well. But I think this is a good sampling. This is a 54-year-old lady with a history of breast cancer, estrogen receptor positive, on an aromatase inhibitor. And one of the common side effects of aromatase inhibitors is joint pain. And she didn't want to take pain medications. This was really inhibiting her function, and so she was referred to integrative medicine. And we evaluated her and recommended a trial of acupuncture, because there's good data for acupuncture for a variety of kinds of chronic pain, but also particularly for aromatase inhibitor related pain. And she had significant improvement after 4 acupuncture treatments. Now, you need more than just 4 acupuncture treatments because she's going to be continuing to be on this, but then you could start sort of spacing these out and needing it less often. But she was able to be functional again without having to take pain medication. This is a 61-year-old lady with chronic migraine headaches most days of the week. She did not have a good response despite a trial of multiple medications and different procedures. And at the first consult, we talked about a number of things: lifestyle modifications, working on diet, exercise, sleep, and stress reduction. She came back a couple of months later, and she had had a significant improvement in her migraines after starting a magnesium supplement that we had recommended. And then decided to try acupuncture next, and had further improvement in her symptoms and was actually able to return to work. And then this last case is a 16-year-old female who was referred to me for painful menstrual periods that were interfering with life and school. She didn't want to take oral contraceptives. And so we discussed several different options, eating a more what we call anti-inflammatory diet, several different supplements that could be considered, and I gave them sort of a rank order in terms of a list of I would start this, and then if no benefit, add this, and if no benefit, add this. And acupuncture as possibilities. 3 months later, she and her mom came back to see me. And she's like, you know what, I decided to become mostly vegan, and I've taken the magnesium, and I don't have painful menses anymore. I don't have to take anything. It's not interfering with work or school. I'm good. I was like, score. So, there's a lot that we can do. So how should we talk to patients about this? Because they're using it. And so it's important to ask, because a lot of times, if you don't ask, they're not going to tell you. And how you ask is also really important. I think one of the biggest reasons patients don't share this information up front is that they think that we as medical providers are going to judge them. I can tell you, I remember firsthand having an experience of this when I was a kid with my mom in my pediatrician's office. And my pediatrician started yelling at my mom. And fortunately, hopefully we don't do that anymore. But it made a huge impression on me, and my mom actually took us out to another doctor instead. But even just the sort of like, oh, and that sort of silence, overtly, sort of covertly tells the patient, like, I don't know about this, right? But if instead, if you ask and say, many of my patients are using supplements and other kinds of treatment, have you thought about or tried any of these things? Very open-ended, welcoming sort of question. And then, if the patient says, oh yeah, I've been taking some supplements, then expressing some curiosity. Oh, that's really interesting. Can you tell me more about what you're taking and how much, right? And really, as I said, this is an opportunity to partner with our patients and to learn. So this is an AARP study that was done asking adults 50 years of age or older if they had told their healthcare provider about their use of integrative therapies, and 2/3 of them said no. It's a lot. These are some guidelines. Ask, again, in this open, curious, non-judgmental way. Don't tell. Be willing to listen and learn. Communicate and to collaborate. Diagnose, right? So a lot of times patients are taking these things because, like my friend told me I should be on this. Or I ask them, why are you taking this herb? Well, I read about it online and it sounded like it was a good idea and it might be helpful. What are you treating? What are you trying to address? So having some sense of that, it can be helpful, because people start these things and then they're like, I don't know, should I continue? Is that doing anything for me? And so explaining and exploring options and preferences. These are some of the considerations that go through my mind when evaluating a therapy, and should we try it or use it, or the patient's already using it, and how should I respond to their use of it? First, I ask myself, is it safe? right? I mean, it's fairly basic but important question. And then I ask about evidence of efficacy. And for many of the things that we prescribe in our conventional training, there's a lot of evidence, although there are things we prescribe that have less evidence as well. As I alluded to earlier, in integrative medicine, we can't patent many of these supplements that are natural products. And so there's no incentive on the part of manufacturers to do detailed studies of safety and efficacy on them. And so the data that we have is limited. But we can still look at the data that's there and make some informed decisions about those. It's also really important to remember that lack of evidence does not mean it's ineffective. It just means we don't know. And that lack of evidence and inefficacy often get correlated a lot of the time and confused. And then also thinking about, is this potentially a harmless placebo, or is it empowering the patient in some way and having a beneficial effect in that respect? I'm asking myself, are they using this instead of or in addition to a conventional approach to treat something that we have good treatments for, to treat a symptom itself? I think the battery on this is going. And then the cost factor, right? Because that's important as well. And the qualifications of the person that they're seeing. I have a young, an older teenage girl who I'm seeing in my clinic right now, and mom got some outside mold testing that came back positive, and she brought it into me, and I had worked with them on, okay, this is what we're going to do. And then they come back for follow-up, and mom says that she saw a mold specialist. I said, well, what are their qualifications? She couldn't tell me. She couldn't tell me what training or certificate or credentials this person had. And this person had recommended several different supplements, and which were different from what I had recommended. I'm like, okay. Well, let's think about this, because if you're going to go to somebody for expertise in something, we want to know that they have the right training and the right expertise, right? So we all go to medical school, we spend all this time to get a medical degree, we have a certain training and expertise that goes along with that. And so does every other healthcare professional, whether they're a licensed acupuncturist or a naturopath or a chiropractor or anybody else, right? But you need to know as a consumer, we need to know the qualifications, right, of the person involved. So this is kind of how I think about this. I think this is a great figure. And Dr. Fishman, you'll note that David Eisenberg was part of this. So as I said, safety on one axis and efficacy on the other axis. If it's safe and it's efficacious, great. There's no question. Yes, by all means, use it. If it's safe, but we don't know how well it works, it's reasonable to give it a try and to monitor it and see how things evolve. If it's efficacious, but we're not entirely sure about safety, it may be okay to use, but again, you want to monitor it closely. And this is something I see a lot with certain supplements that may have certain interactions with some of the pharmaceutical medications that our patients are taking. Right, so I've got a patient on tacrolimus who's a kidney transplant patient, and he's trying to get his cholesterol down because he can't tolerate statins. All right, well, there are about 5 different supplements that I can choose from to help lower his LDL and raise his HDL and improve his overall cholesterol profile. But some of those have the potential to interact with his tacrolimus, which we don't want to do because we don't want to make him super therapeutic and we don't want to make him sub-therapeutic, right? So I have him starting these one at a time, and we're closely monitoring his tacrolimus level. And then finally, this last category, it's not safe and it's not efficacious. Those are the ones where we want to discourage people from using it. And rather than just saying, oh, don't use it, giving an explanation for why, because patients need to understand the rationale. Otherwise, they think we're just being judgmental or have a narrow mind about these things. So these are some of the resources that I commonly use, and I'm looking stuff up all the time because the data and the science is changing around this constantly. As I said, David Brakel has an excellent textbook on integrative medicine. It's just recently updated. You can access the entire textbook online through the library here. Natural Medicine's database, or NatMed Pro, is put together by a group of pharmacists, and they have monographs on hundreds of supplements. And so, you can type in ashwagandha and get the monograph and read through it. You can see cited all the studies for different health conditions, different doses. It'll give you the citation. You can look it up yourself in PubMed if you have a question about it. It'll tell you about potential herb-drug interactions. It's a fabulous resource. It's a little on the conservative side because it's put together by a group of pharmacists, but it's excellent. And then PubMed and the National Center for Complementary and Integrative Health I also use as resources. As I mentioned earlier, the Academic Consortium for Integrative Medicine and Health is also a wonderful resource. If you're interested in learning more about this, they have a conference that they put on every year. We at UC Davis are a member of this institution now, and so you as students at UC Davis are all members. And they have opportunities for networking and they post jobs and other resources. So I intentionally ended this a little bit early because I anticipated that there might be some questions. Yeah.
Yes, outside of your
microphone, you can bring it out.
Oh, okay. Who's the object?
So if there's a specialist or anyone outside of primary care, how would you suggest incorporating like integrative medicine practices and discussions when you maybe don't have like a lot of time to interact with the patient?
As a primary care physician, you mean in that setting?
Oh, I
Or-
guess I meant more like if you were a specialist in another field.
Oh, in another field, how to incorporate
maybe
that?
you had like a shorter time to consult.
Yeah, great question. So I think the most important thing is just starting with a simple question, right? And if you're a specialist seeing a patient, you're probably seeing them for a very specific condition. And so just starting with that simple, are you using any supplements in general or to address this, or have you tried any other therapies, and seeing what the answer is that you get. There are people in specialties who really focus in integrative medicine. So they're integrative gastroenterologists, for example. We have an integrative neurologist in our clinic who works with us. There are people in the mental health sphere who focus on using that. So there are also specialists who focus on integrative medicine, and so there are ways to bring that in. And it starts with getting training and knowing kind of what are the therapies that are out there and available, and how can they be useful for the conditions that you tend to see. Yeah.
My question's kind of building off Catherine's. So, my question: what is the pathway to becoming an integrative physician? Because the specialist who, for example, is doing like practicing integrative medicine, whatever they're specializing in, is it like a fellowship? What is the actual step to get the license?
Yeah, that's a great question. And that has been something that has evolved over time, but there is actually now a board certification in integrative medicine, so I'm duly boarded. And there are fellowship programs. There are fellowship programs, most of them tend to be in internal medicine or family medicine, but there are also fellowship programs that are distance programs. So instead of doing it after residency, you can be like out in practice. University of Arizona has a 2-year distance fellowship where a lot of it's done remotely, but you come on site for 2 weeks out of the year. And you can do it while you're working. So we have a physician in our practice who did that.
Sorry, just a quick question. Are integrative medicine and lifestyle medicine the same?
Great question. Integrative medicine uses a lot of the tools of lifestyle medicine, but we also use more. So lifestyle medicine they don't get training in acupuncture, in what is acupuncture, how to use acupuncture. They're not using a lot of the supplements potentially that we might use in integrative medicine. It's a good start, starting with diet, physical activity, social support, sleep, and there's some mind-body tools that are added in there. And that's a really good foundation. So it's a great place to start. Integrative medicine is a little bit broader. And there are two. Lifestyle medicine has its own separate academy and certification process. Yeah.
I was just curious, how open your patients are to your treatments, and I guess more specifically, integrative medicine treatments.
Yeah.
Do you ever find that patients are kind of resistant against the treatments that you kind of provide, or the option that you provide?
Yeah, great question. I would say most people are open. They've gotten the referral, and so they come see me. Many people have self-referred, but many of them are referred by a physician and know, and some of them don't honestly know a lot about what we do. But I talk with them about the evidence, and I give them the options. And yeah, sometimes there are people who are not interested in engaging in the recommendations I've made, but that's a small minority, I would say. Yeah. You're welcome.
Hello.
You're on.
Sorry. I see a lot of online, especially fitness industry, a lot of supplements in the weight loss or metabolic health arena, and they're usually pretty broad or vague, and some of them I feel like you don't know specifically what's in them, and I guess just how do you handle that with patients where it's you want them to be able to take supplements that are working for them and that are safe, or at least that they're not that they're harmful. But how would you work with that when there's not really sure what exactly they're taking, that they're right now?
Yeah, that's a great question. It could be a whole talk in and of itself. But the short version is we instruct patients to bring all their supplements and medications to the first appointment so that I can look at them physically. There is a lot of questionable stuff out on the market. Supplements are not regulated by FDA in the same way that pharmaceutical medications are regulated. And so they can have adulterants in them, and many of them do. There are certain places that I would never shop for a supplement because of the quality of the products that they carry. And then other places where I feel like it's fairly safe. But, for example, there have been studies showing that certain bodybuilding drugs have steroids or other pharmaceuticals in them that are not listed on the label. There have been studies showing heavy metal contaminants in certain products imported from other countries. So you have to know where the safe place is to get supplements from. And then you want to know what patients are taking. So the other thing is because of the way FDA has regulated supplements in this country, manufacturers cannot put any health indication on their label. So they can't say, this is good for cardiovascular disease. They can say, this supports heart health, right? So you have these vague sort of statements. So you have to look at the label, you have to look at the ingredients and tease apart what's in there. And that's, if you don't have the training in that, that's where having somebody who you can refer to, who can go over that and look at it in detail can be really helpful. Yeah.
Hello, thank you for coming today. I wanted to ask, you mentioned that a lot of the supplements and things aren't really tested. There's not a lot of funding being brought into them because it's not profitable, pretty much.
Yeah.
But I was curious about what kind of research is in integrative medicine, or what kind of research is occurring, and
Yeah.
what is the process of that like?
Great question. So NIH, and particularly the National Center for Complementary and Integrative Health at NIH, has funded many studies, but some of the other institutes have as well. We have a lot of data for mind-body medicine, studies of meditation-based interventions, for example. Increasingly, we're having more studies on supplements. So there are some out there, but just not like the big 5,000 person randomized controlled trial that you might get with some of the cardiovascular medications that we prescribe, for example. So, I'm always looking up studies on PubMed, and most of the stuff I recommend, and I don't recommend a ton of supplements for specific conditions, and that's based on published studies. So for example, standardized turmeric, good data for promoting remission in ulcerative colitis. And there's a certain dose associated with that. You go, look, there's 500 different turmeric supplements that are out on the market, and they're not all the same. And you have to know, when you're looking at the label, what is it that you're looking for? And I tell my patients, these are the things you need to see on your label to know that you've got a good turmeric supplement.
I have a question kind of thinking about like the social factors. So first question is integrative medicine covered by insurance? And then as well as the services recommended by integrative medicine, such as acupuncture, massages, supplements, like when I kind of think of those things, I often kind of naturally associate that with more of like a privilege in society.
Absolutely, it's a big issue. So visits with me in the Integrative Medicine Clinic are covered by insurance. I use standard medical billing codes, so that is not an issue. Increasingly, insurance is covering acupuncture, so most commercial payers cover acupuncture. Medicare will cover acupuncture only for chronic low back pain, and that's based on a demonstration study that was done in the state of Vermont a couple of years ago. Hopefully with time, as we get more data, they will start covering more for their patients as well. Certainly, many of the supplements following certain diets can be cost challenging for some people. And so I try to be very targeted in my recommendations around those things. And there is a whole organization called I Am For Us, Integrative Medicine for the Underserved, that really focuses on how do you make these therapies available to underserved populations. And they have a conference every year that they put on. And they put together a lot of materials around that. Yeah.
Question, right, Jeff?
I was just curious, what a typical day or schedule would be for you. Earlier, I heard that you had an hour with the patient. I was just wondering, is that for every visit or just the first visit?
First visit's an hour, follow-ups are half an hour. So, in a half-day session, I'll see anywhere from 4 to 8 patients.
All right, we're gonna take one more question for the hour and wrap up.
Thank you for your presentation.
You're welcome.
I really appreciate integrative medicine's ability to offer tools that people could reasonably start right after that visit. That being said, one thing that came up for me was thinking about our classmate had mentioned wider social factors, imagining a lifetime of daily interactions of racism on cardiovascular health.
Exactly.
Maybe a 30-minute walk may not completely fix that or eradicate it. So I have a twofold question about what is the physician's approach or even ethical discussions around how to bring up those social factors and those social barriers. Just to not, in my head, maybe this advice perfect, just so that patients don't feel it's 100% personal responsibility to work on those issues. And then what is the role of the physician using those clinic visits in wider advocacy and taking it sort of outside of the office?
Yeah, great questions. Meta questions. So the first one, what is the role of the physician in not making it totally on the patient? That's a really important thing to recognize, and this is not quite the scenario that you're getting at, but I have patients who come to see me who've been diagnosed and treated for cancer, and they're like, I ate the perfect diet, I exercised every day, I managed my stress, why did I get cancer? And I feel that my role in that situation is to have a conversation with them of like, it's wonderful that you did all those things, and those things are probably why you're in my office today, and you have survived your cancer, and you're doing well. But there are a number of factors, genetic and other environmental factors, that are outside of our control. So you did the best you could, and it's great that you're here to have this conversation with me, and we can talk about, you know, whatever little tweaks that might be helpful, but you're not the one to blame for why you have this cancer, right? And so, you know, integrative medicine is about meeting patients where they're at. And that's why I need the hour with the patient at the first visit, is to understand their life circumstances and what's going on. My social history is much more than just alcohol, drugs, and sex. It is, who do you live with? What's the social situation like at home? Do you feel safe in your home? It's on our questionnaire. I mean, some of this is on our 12-page questionnaire that patients fill out before they come to see me. Some of it is stuff that I'm asking in the room, because all of that plays a role. And some of that we can mitigate with some of these other things. And some of it, you know, is just part of the milieu. And then, you know, broader social context, we each have a role to play. Some of us is with patients. Some of us, I do a lot of research. Some of it's with policy. Some of it's out in the community. We just have to do what we feel individually called to do. All right, thank you.
Dossett. You know, you raise an issue of really what I would call the social determinants of wellness, which is something we don't really look at. Maybe we could do a lunch and learn on that subject. It's a very profound topic.
Yeah.
I want to thank Dr. Dossett. We give her a round of applause. I want to recognize John Liu, who is really our ambassador within the School of Medicine. And John can help you connect with our Office of Wellness Education. And I think he's in part responsible for getting such a great turnout, and hopefully we'll continue to get turnouts like this, because we want to continue to do these programs. We'll be back in January to continue these. If you guys want to be involved, let us know, let John know, let me know. Let us know what you want to hear about. But I think we got a new topic here today, and I very much appreciate that. Thanks for coming. I hope you enjoyed lunch. I will see you again.